Welcome to the Neuromodulation podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare. There is a slide deck presentation as a companion to this talk. Listen to this episode on Spotify or YouTube to watch along. This is Mandy Soleil. I'm here to introduce Neurotech Business Report editor, James Cavuoto, who is gracious enough to share the live recording of his presentation, 2024's State of the Neurotechnology Industry, which was a session at the Neurotech Leaders Forum in November of 2024 in the San Francisco Bay Area. Each year, we find value in attending this session and are grateful to have the opportunity to pass it on to our listeners. The INS does not endorse anything said in this presentation. We seek to provide a neutral platform for the consideration of industry perspectives and offer access to this presentation to create visibility into what one of the leading neurotechnology reports has to say of the field at this time. In this session, James Cavuoto surveys changes in the competitive landscape and challenges confronting the industry in the years ahead. The Neurotech Leaders Forum is a 2-day neurotechnology conference that offers a unique space for industry leaders, investors, and entrepreneurs to connect. Sessions in the 2024 Neurotech Leaders Forum covered topics such as advancements in neuromodulation, neuroprosthetics, neurodiagnostics, and more, with a focus on practical applications like brain-computer interfaces and stroke rehabilitation devices. This event is hosted by Neurotech Business Report, a publication dedicated to providing business and technology professionals with up-to-date and forward-looking information about the field of neurotechnology and future developments that will affect the venture capital, research, and startup communities. For more information, head over to neurotechreports.com or check the show notes for direct links. Now let's dive in.
I want to talk a little bit about what's been happening in the neurotechnology industry in the last year. What are some key market and technical trends that are going on? There have been some exciting developments in neuromodulation therapies for treating Alzheimer's disease. A lot going on with the PNS market. Plus, reimbursement is an ongoing issue. One of some of the key events of last year, one of the biggest, is the deal between Boston Scientific and Axonics. To date, the largest merger and acquisition deal that has happened in the neuromodulation industry in the 24 years that we've been covering the industry. So that's a $3.7 billion deal. Needless to say, that deal is not just exciting news for the two companies, but it's exciting for a lot of startups. And the reason is investors look for exits. And when they have examples of a gigantic exit like this, it just makes them more excited and more interested in funding early stage companies. So that's good news really for all of us. Another event that I think is significant, and we wrote about this in a recent issue of Neurotech Business Report, after almost a 10-year absence, Abbott, which acquired St. Jude Medical a few years ago, which was the biggest deal before the Boston Scientific Axonics deal, St. Jude Medical had, about 10 years ago, conducted a clinical trial of DBS for depression. And it was based on early, very promising data obtained by the trial sponsors. Alan Mayberg was one of the principal investigators. Unfortunately, that trial was halted because of a futility analysis. And when it was halted, St. Jude Medical at the time said, "We're leaving." In fact, we interviewed Dan Starks, who was the CEO of St. Jude at the time, and he was exasperated and told me personally during JP Morgan right after this event 10 years ago, "We're out of depression. We're not going back in that." And true to form, they were out. Last year, FDA gives breakthrough device designation to Abbott for what? For DBS for depression. But what changed? What changed mostly was the time horizon. The early data, that futility analysis based on short-term results didn't look so good. But as it turns out, the longer you go, 6-month data looks better than the 3-month data. The 12-month data looks better than the 6-month data. The 24-month data looks much better than the 12-month data. And by the way, this is not only true for depression. We've seen this in a number of other applications of neuromodulation. So something for us all to keep in mind when you're comparing a neuromodulation therapy versus, let's say, a pharmaceutical therapy, the time horizons may not be the same. So that's something we want to keep in mind. Recently, Medtronic and Axonics were involved for many years in a patent lawsuit regarding the leads used in their SNS, their sacral nerve stimulation systems. Pleased to report that lawsuit has been resolved in favor of Axonics. Nobody wins in lawsuits. Yes, Axonics wins, but it's a lot of money wasted. It's a lot of time wasted. And frankly, it's a lot of risk, right? In the process of this lawsuit, Medtronic had several of their claims disallowed. So that's a bit of news. We had an article recently about the market for craniofacial applications. Prior to this year, you couldn't use SCS or neuromodulation devices. Those you had to use below the neck. And Curonics got FDA clearance for the first time for craniofacial applications. Many of you may have seen Morgan Stanley, the big financial firm, put out a report that the BCI market has a $400 billion TAM, total addressable market. Now, they went on to talk about some other specifics, and if anyone is interested, and I'll take, if you access the current issue of Neurotech Business Report, you can get our take on it. And of course, you've probably seen other people who have takes on it. I think it's a very encouraging thing to get a report like this. Some of the details you might quibble about, but nonetheless, the BCI industry got very excited. Many of the CEOs took to social media to comment on the implications of that particular report for their industry and for funding in the space. Of course, we already know the impact of Elon Musk's Neuralink company in a lot of ways. He's raised all boats. The investment that's coming for Neuralink has also helped bring in investment to some of the competitors in that space. What else has been happening? The Neurotech privacy laws. So a couple of different states, Colorado, California recently have passed laws about privacy, mostly impacting consumer neurotech. And we'll talk a little bit about consumer neurotech, but these are what we identify as some of the key events of the last year. This is just a quick gut snapshot of where we see the implanted pain neuromodulation space. The key thing to see here is that the orange bar is what we would consider traditional SCS. And the blue part is the PNS market, but you can, if you were to just look at the growth rates, PNS market, even though it's small by comparison to SCS, it's growing at a higher rate. And there's been a lot of activity in the migraine market, and this includes both minimally invasive devices. Neurotechnology is an example of a surgically implanted cutaneous device. So there's another company called Salvia that is a European company that has a product in that space. There's also several companies that are offering wearable products. There's a photo here of a Theranicals device, which is actually ran on the arm. A few other vendors, including Gnarly, have a head-worn band. And then finally, some of the SCS and PNS market, mentioned Curonics, we'll most likely see others, especially now that they got their 510K. So we expect to see activity in all three segments of the migraine market. Actually, a couple of scientific reports that I think worth talking about. And the first one here, we reported on this in the current issue of a Neurotech Business Report, but this is based on some very interesting research. And if you want to check it out, but there's a link to the investigators. But some very interesting research that points out some commonality between pharmaceutical and neuromodulation approaches to treating Parkinson's disease. And in fact, these investigators were able to demonstrate that neuromodulation could actually mimic the effect of dopamine. And I think that's interesting, number one, because it's shedding light on the mechanism of action, right? Not only the mechanism of action for what's gone wrong in Parkinson's disease, but also a little bit about what goes right in a non-disease state. So the more we learn of the neural circuits that are involved in controlling movement or controlling mood or controlling, whatever it is that we're looking at, the better we're going to be able to develop effective neuromodulation therapies. And in fact, these authors have identified specific targets that will be worth exploring. Many of you know that investigators in the past have used both STN, the subthalamic nucleus, as well as another target in the deep brain, and achieve similar results. But that doesn't necessarily mean that both centers are playing the same role. So again, the more we learn about the function of these neural circuits that control fine movements, the better our neuromodulation therapies will be. And it may well be that there's combination therapies, that there's things that you can do in combination with a drug regimen and a neuromodulation regimen, right? Because the way things stand now, DBS is really only going to be used after the drugs have failed, right? So maybe there's 3, 4, 5 years that go by. And of course, there is some debate within the neurology community as to whether DBS can be curative. This hasn't been proven, but there are people who believe that you can actually change the underlying physiology of those circuits to reverse the damage from a movement disorder such as Parkinson's disease or essential tremor. But as things exist today, and this is mostly true of most implanted devices, you don't go towards the implanted device until the drugs have failed. And what that means is that the penetration rates are still in the low single digits for DBS, for SCS, for SNS. And the good news there is that there's wide open opportunity for increased sales. But the bad news is for implanters and the vendors who work with those implanters to get that help to patients who might otherwise benefit. The second paper I mentioned here has to do with injectable therapies. And again, we will reference an article from Neurotech Business Report where we talked about some of those. In terms of market activity, what's been happening in our industry, well, of course, I already mentioned the Boston Scientific Axonics deal and the significance of that. There have been some smaller deals between companies. Science Corp, which is a BCI company in the East Bay, based in Alameda. In fact, their CEO was a former CEO or the former president of Neuralink, Elon Musk's company. He left, as many of his executives. He left to either start his own company or join another company. And Science Corp bought the assets of Pixie Vision, which is a European company that had been developing a retinal implant for treating visual disorders. And they just recently demonstrated some positive data from from 5 users in a clinical trial of AMD. So that's really promising. And hopefully the new owner of that technology will be able to move forward in visual neuroprosthetics. Another European vendor called Onward, they're based in the Netherlands, and they signed a deal with an organization called Clinitech to market their BCI system. So basically what they're going to do is combine their epidural and non-invasive stimulation systems for restoring function to people with SCI, to combine that with a BCI. And of course, there have been previous efforts. Researchers at Brown University many years ago teamed up with the FES researchers from Case Western Reserve and the Cleveland FES Center to marry BCI technology with FES technology. So this isn't the first effort to do that, but it is probably a more significant commercial as opposed to a research effort. So that's a trend we might see more of in the future. Another BCI company, Precision Neuro, they've teamed up with Lawrence Livermore National Labs for some of their development. So there's just a few snippets of some partnerships that are going on. Some key clinical trials, again, there are many, but a few that I want to highlight. Medtronic has shown 12-month data from their DTM technology. This is technology that they acquired from Stimgenics when they bought that firm a few years ago. Many of you have heard from Dr. Vallejo, who was a speaker here a few years ago. And so that's a very promising new form of spinal cord stimulation. So that data looks interesting. Neuro, who uses high-frequency stimulation, their Senza trial, they released 24-month data that looked very good. Mainstay at the recent NANS meeting presented 5-year data, which is the longest that I've seen presented at a scientific meeting like NANS, and the data's been very good. And again, Mainstay is an example. This is a company that, when they did their clinical trial, failed to meet their primary endpoint. But why? A couple of reasons. One is there wasn't significant, distinct difference between the control of sham stimulation and the active group. I'm going to talk a little bit more about sham and control groups in a minute, but the bottom line is that might have been true after 6 months. But if you look out 12 months, 24 months, the data just keeps getting better and better. And of course, they've gone to 5 years. So Mainstay is not a traditional SCS company, but it's a company, I think they refer to their neuromodulation as neurorestorative. But we tend to lump them in with SCS companies, even though it's technically not stimulating the spinal cord. They're stimulating the multifidus muscle, but the effect is the same. You're reducing pain in people with mechanical lower back pain. Neuropace, they presented the results from their Nautilus trial. So there's a lot going on in epilepsy, even though that's a more mature segment of our industry. We've been covering the neuromodulation industry for 24 years now, and for the most part, it's been electrical stimulation. In the last couple of years, we've seen other forms of stimulation begin to take root. We're going to hear from some companies who are active in these other forms, including focused ultrasound, including mechanical and vibrational stimulation. And there's a lot going on with sensory stimulation. A company called Cavuoto Therapeutics is an example. They have some very promising data for treating Alzheimer's disease, and their mode of stimulation is not electrical, it's not magnetic, it's not optical, it's basically sensory. So you're going to be presented with visual and auditory stimuli, and they've centered in on this 40 hertz frequency that appears to be critical. And you're inducing those neural circuits, not with stim, not with an electrode, not with magnetic, not with optical or optogenetic therapy, but simply by wearing a headset. And so this is a very promising and interesting approach that bodes well for non-invasive neuromodulation. Is there a way to achieve effects without having to surgically implant a device? Another opportunity there is a new form of stimulation, bioluminescent optogenetics. There, the idea is, I'm sure most people here are familiar with optogenetics. You use genetic engineering techniques to modify a receptor cell. It could be in the visual system, or it could be in the brain, and you make it responsive to light of a particular wavelength. So now only those cells that have been genetically modified will be responsive. You can select, but still somehow you have to deliver light of a specific wavelength, whether it's red or whether it's green. How do you get that light? Well, you can implant an LED or maybe find a way to transmit it, but that remains a challenge for optogenetics. BLOG, bioluminescent, gives you an opportunity to non-invasively stimulate and deliver optical energy to an optogenetic system. And this is far out stuff. We're talking probably 5, maybe 10 years down the road before we would see any commercial activity here. But again, it opens the doors to lessen the degree of invasiveness for neuromodulation therapy. Referential stimulation. It's a little bit of controversy here. There are some people, McIntyre, for instance, is one that we've spoken to, who's not convinced that this is going to work well in humans, even though the rat data looks really interesting. And the idea here is if we present 2 waves of slightly different frequency, you're going to get a beat frequency, or you're going to get some kind of interference, and that interferential stimulation can be effective. Again, it's a way to non-invasively produce maybe some of the effects of DBS. The jury's still out, but there are people doing it. We have that picture here of a company called Otolith, which has a mechanical vibrational stimulation for treatment of vestibular disorders. So that's, it's a market opportunity where there's really not a lot of activity. There's really not a lot of options for people suffering from those types of disorders. New materials. There's a lot of new materials that are being used by vendors. Graphene is one example. Carolina Aguilar, who is the CEO of a very promising European company called InBrain Neuroelectronics. They're pioneering BCI work using graphene. There's other materials that people are looking at. So in terms of traditional platinum or iridium electrodes, there's a lot of new options. Liquid materials are another area. These are very flexible types of implants that can conform to the mechanical properties of the neural tissue that they're living with. Organic materials, again, for many of the same reasons, have great promise as alternatives to metal electrodes. And injectable conductive hydrogels, another promising area, the opportunities that these new materials present. So this is one of the articles I mentioned on liquid-based materials, and this is the research article that I was mentioning about biolumin optogenetics. So you can get the reference here. There's been some significant regulatory approvals. Of course, I mentioned 3 that are significant, both on the DBS side and the SCS side. Medtronic got approval for their Percept RC-DBS system. This is a closed-loop system on DBS and SCS. Their Inceptive closed-loop SCS system got regulatory approval. Of course, many of you will remember that a couple of years ago, an Australian firm called Saluda entered the market, the SCS market, with their closed-loop neuromodulation system. In some respects, the Medtronic offering is in response or perhaps in competition to what Saluda's done. But we will likely see more activity. We will likely see more closed-loop neuromodulation systems. A lot has been happening on the reimbursement front. I'm not going to spend a lot of time talking to it, but I will reference your homework because this article is written by Victor Peikoff. He goes into some detail about advances in rates for reimbursement, both on the lead side and on the IPG side for specific applications. Bottom line, there is a wide variability depending on the indication, depending on the target, depending on, is it PNS, is it SCS, is it 2 different components, or is it a complete system with leads and IPG? All of these things will affect the reimbursement rates. Read this article if you're interested. I'm not going to go into great detail here, but there's been a lot of VC funding activity, including very recently Sheratronics getting a $66 million round and InBrain getting a $50 million round. What's interesting here, these are relatively early rounds getting significantly higher levels of funding that generally you would see in maybe a D round, or sorry, at least a C round or a D round. And we're seeing A rounds and B rounds being valued much higher. So these are just a few of the VC funding. I'm going to talk a little bit of uncertainty. Of course, we just had an election and there's a new administration coming in. We don't know what the impact of that is going to be, but there will most likely be an impact as the new administration may choose to replace HHS people, whether it's at the top, whether it's at lower levels, remains to be seen. There's definitely some uncertainty. There's also been some recent leadership change at CDRH, which is the Centers for Devices and Radiological Health, part of FDA that approves medical devices. Jeff Sherman, who was the head for many years, has stepped down, and there is a new director who's been appointed. Jeff Sherman has been, although he did take some criticism in the early days from, including some people in this industry who originally felt that it was taking too long to get medical devices approved. Well, that picture improved significantly in the last 5 years, so much so that it reversed the situation with Europe, where a lot of American firms were going to Europe first to get CE mark approval because it was taking too long in the U.S. Now it's exactly the opposite. And many people have Jeff Sherman to thank for that. Now, he stepped down. Unfortunately, there was a little bit of controversy having to do with his wife, who was an attorney. The New York Times did an investigative piece. It didn't really uncover any specific wrongdoing, but there was an appearance of conflict of interest because his wife's law firm represented one of the companies that was getting approval, of course, by Supreme Court standards, but that's a subject for another day. But at any rate, it may be impactful if there's a perception among members of Congress or perception in the media or a perception from patient communities that we've just been too lax in approving medical devices. So something we'll have to watch for in the years ahead. I mentioned already there's been some state privacy laws. The Shelton decision was a recent Supreme Court decision that basically said, hey, wait, only Congress can pass new laws. And maybe some of these national rulemaking decisions over the line. And it now opens for debate or for lawsuits as to whether decisions that have been made by agencies like the FDA or FAA, for that matter, get called into question and get reversed. On the one hand, that could be good news if it means you can get faster approval. On the other hand, if it creates uncertainty in the mind of investors, what the regulatory and reimbursement landscape is, it might make them a little slower to write those checks. So those are things that we're going to have to watch in the years ahead. I want to leave you with some noteworthy quotes. These are quotes that we have taken from people who've presented either at our meetings or at conferences. I will mention Tom Oxley from Synchron, who gave a keynote at our Bioelectronic Medicine Forum in April in New York City. He said, neuroprosthetics doesn't care whether you sense or stimulate. It cares whether you restore a brain function. And I think that's important. The point he's trying to get across is, okay, it's our device. That's not necessarily a stimulation device, but it's still a BCI. And the bottom line here is we're helping the patient. Are we restoring function? We shouldn't be looking at, is it delivering energy or is it sensing energy? If some of you were here last year, you'll remember that we had one of the authors of an unpopular paper that was published in JAMA Neurology that was very critical of SCS. To his credit, this author, Professor Druba from the UCSF, agreed to come here and speak to this organization and was honest about some of the shortcomings of his report. And he was actually very gracious in responding to questions. We actually have a video of that. If anyone is interested from last year, we'd be happy to send that to you. Another speaker, this was during the recent INS meeting in Vancouver, is Mark Lonishuk. He is the new head of Presidio Medical. It turns out that the founder of that company, Michael Ackerman, used to be one of his interns. So he gave us was, don't piss off your interns. You never know where they'll end up. I thought that was funny. And then lastly, a quote from a patient who gave a talk at the NANS meeting earlier this year in Las Vegas. He listened to me really well. It was a really moving talk. This was from a Parkinson's patient who was reticent at first about, do I want to get a brain implant? And he was very impressed that his physician listened, right? It wasn't just talking at him, but listening carefully to what were the needs and the concerns of this patient. I think that's really good advice, not just for clinicians, but for vendors to understand. I mentioned that I think we, at some point, want to rethink how we treat placebo effect. The web link is here on the screen. And this is a commentary that I wrote a couple of months ago called The Baby in the Bathwater. Are we throwing out the baby with the bathwater by basically ignoring the potential positive impacts of the placebo effect? This is the example of one of the more recent papers recently published in Nature that identifies the neural circuit for the placebo effect. And anyone who was at the INS meeting in Vancouver, Dr. Robert Luby, who is the editor of the journal Neuromodulation, gave an excellent talk about years worth of data indicating that there is a physiological basis for the placebo effect. And to quote him, he said, the fact that we don't include this in our model is a mistake, is a profound mistake. And so I think that was significant coming from the editor of a journal. A lot happening. So that's my talk.
And with that, this episode comes to a close. We are so grateful to Mr. Cavuoto for allowing us the opportunity to showcase this session on the show. We wish all of our listeners and guests a most prosperous 2025. And if you haven't already, take a moment to subscribe now so you catch all the latest updates on what's coming in Season 2. Thank you.